I think the biggest challenge has been the fact that we've had to keep going. Closing down services hasn't been an option for us. The people that we work with need us. They need us all of the time, really. Some of them on a 24 hours a day basis. So of the 18,000 people who come to us for help in the course of any 1 year, nearly all of those people have still been needing our services during the period of the COVID epidemic. Well, in order to keep services going, we've had to do a lot of reorganisation. At one stage, around 20% of our staff were shielding in line with government guidance, so they could only work from home. They weren't able to come into work and sort of staff the rotas. There are other people working in our office locations that who we've had to ask to work from home so that we can get the social distancing in place. But the biggest issue, I think, has been in hostels and supported accommodation, where we still need to staff the rotas, but in a way that's safe for the staff and safe for the people living in those properties. So there's been a huge amount to work through. They have been absolutely fantastic in the way that they've responded. It isn't just our staff who've responded very well to this, it's our service users as well. Because I think they have realised that they need to perhaps to scale down some of their expectations of services and accept the fact that, some of the things that we would have been able to do in terms of sort of, outward looking support have not been possible. And they've really sort of helped us to get through by complying with the guidelines, not being difficult with staff when they've been bored and fed up, and also, taking quite a lot of responsibility. We work with a very wide range of people. In the course of a year, we house around about 3,000 people from time to time. And they're probably the most vulnerable of the people that we work with, those that we actually house, because other landlords won't house them, at least for the time being. But there are also many people to whom we provide drug and alcohol treatment services, other forms of health intervention, employment services, support to prevent them from becoming homeless or from getting into crisis situations. So it's a very wide range of people, but they all have needs of some kind that we need to help them with. And for those people who have multiple and complex needs, for instance, combinations of homelessness, mental ill health, physical ill health, substance misuse issues, they are the most vulnerable people we work with, probably about a couple of thousand at any one time. And COVID has accentuated their vulnerability, particularly those who've been sleeping rough. And there has been a central government sponsored programme called Everyone In that's brought all of those people into hotel style accommodation, and in all the areas where we work we've been supporting that process, often making the referrals, doing the assessments, working with people in the hotels, doing resettlement work. We have had support from our fantastic donors. Between them have donated around £40,000. We've had an emergency grant from the National Lottery Fund for £200,000, and that's helped to fill what we call the COVID gap. Beat the Streets, again, we've repurposed some of the money from that programme, and also Nottingham Building Society have been incredibly generous with a £30,000 grant and also an amelioration of rent on one of our properties. So great effort from many of our kind of sponsors, our individual donors, our supporters in the corporate world, really to keep the financial impact of COVID as limited as possible. There is a financial hit to Framework, but we think that it's going to be manageable. And what that's done is it's meant we could concentrate on the actual work that we needed to do to support people who otherwise would have been in very, very vulnerable situations. We had people kind of using night shelters, using hubs where they were, just literally sleeping several people in a room. That's not a safe place to be when you've got an epidemic like this circulating. So getting those people into safe environments was really important. I think the epidemic still has a long way to run, unfortunately, and we are now emerging from the lockdown, and we're beginning to see cases rising again. So the challenge has not gone away, and we will still have to keep those services going, because people are not going to be able to cope without the accommodation and the support and the healthcare that we're able to provide them with. So it's a challenge to which I think the organisation and its staff and service users have responded to wonderfully well so far, but it's an ongoing challenge. I think there'll be loads of learning that will come out of this epidemic for many organisations, and one I think bit is to reinforce what Framework's been saying for many years now, which is that we need systemic responses to the needs of individuals. People have a variety of needs. It's no use saying, oh well, we can house you, but we can't help you with your drug problem, or we can help you to get into employment. We can't help you to have enough money to get along to the interview. We need to have these joined up systemic responses. And I think the epidemic has really accentuated that, because there are many people around who would have been better able to cope with it if they'd had more joined up services in place at an earlier stage. And I think we've seen that very clearly. So one piece of learning I think is that we do need to join up housing and support and health and employment services much better in the future. We've been able to make more use of things like telephone support, online support, and I think we can again do more of that in the future. It's sometimes a more efficient way to help people. And I think finally the importance of quality in the physical surroundings for people, that there is space, that there is somewhere to go if you need to isolate, that that it's somewhere nice to be, not somewhere kind of depressing to be, so that if you can't go out, you can be there and it can be okay. Quality of the accommodation offer and the support offer, the importance of that actually this is a job not just worth doing but worth doing well, and that has to be resourced. And I think if the will is there from central and local government working in partnership with organisations like Framework in the future, we can respond better and more comprehensively and in a way that's more effective in terms of the outcomes, if we are prepared, if we have that commitment and that will to do it well. Framework is in a strong state. We have withstood the epidemic, at least so far, and I'm confident that we will be able to respond well to whatever more challenges emerge. So we're not here to kind of sustain our organisation, we're here to resettle and sustain our service users. And for the moment that means that we aren't going anywhere. And so I'd like to thank our supporters for the role they play in making that possible. Our individual donors and our small charitable trusts that support us, some of the corporates that support us, are really crucial, because their money makes a difference in that we can spend it by and large on the things we need to spend it on, and that's been crucial because we've had to redirect. We've had to do things like we've had to buy PPE, for instance. We've had to procure mobile phones to enable people to keep in contact with us while they are self-isolating. We've done something we've never done before, which is buy 400 cans of super strength lager. And people say, why did we do that? Because when people are self-isolating, if they are addicted to alcohol and they can't get their hands on it, that could be life-threatening. And those are the kind of things it's really hard to kind of get a statutory funder to contribute towards. So the money that we get from individuals, because of the flexibility with which we can use it, it's always crucial, but it's been particularly crucial during the period of the pandemic. So I'd just like to thank all of our supporters, because, you know, without you, we couldn't be here. We would not have been able to survive.